Welcome to the Clinical Toolbox. This module reviews some of the clinical tools that have been developed to assist both students and their nursing instructors. The most important part about any rotation is your organization. We know as nurses that the best laid plans never go as planned. Putting all of your necessary paperwork in a binder is what has worked for me. In a moment, I'll talk about your course procedure sheet, clinical expectations. Once you write this document, I suggest you put a copy in your clinical binder. Any and all tools you create to keep yourself and your students organized, you should keep a copy in the binder. Plan to take this with you every clinical day. Trust me, you'll be happy that you have it with you. One of our jobs as clinical instructors is to be a role model, as I've shared with you. Therefore, modeling organization is very important too. I can't stress enough that being organized really helps you with your time management. And again, this is a skill that we are always working with our students with. You are probably working in another position. Therefore, it can become difficult to remember where you left off with students between each clinical day. And let's face it, it was hard for me, even when I was teaching full-time, to remember where did we leave off last week. The same thing applies to students. All of their work should be kept organized in some type of a journal, and they can have the tools that you've assigned them to complete in the journal. They can put their reflective notes here so that you can read them and watch their progress. Most importantly, the expectations for the rotation should be readily available to them every day. I required students to have their binder divided by week, which made it very easy to follow their progress. The journal became an invaluable tool for me to complete both the students' midterm and then their final evaluation. Then together we could review their progress. This became a very concrete tool for both of us. And then in the circumstance where a student may be struggling and they need to have weekly goals written in meetings with you, then again, this became a very valuable tool to work with the student weekly. After you attend the orientation at the college, consider attending or arranging an orientation and tour of the clinical unit if you haven't done so already. Consider shadowing a nurse on the unit to get a better idea of the unit flow, expectations of the staff, and working with students, things like that. And if you're already assigned to a clinical rotation where you work, then of course you're all set. Well, maybe not. One caveat. It can be sometimes hard for staff to know which role you're in today. So make sure you let them know that you are working with students today and cannot carry out your usual duties. Because, again, it can be hard for staff to remember that you're there with students and you can't do those things that you normally do. And it can be hard for you too, because you know how to do them and you know you can do them, but you've got to draw the line. We as instructors need to keep that in mind, that we are with students today. If you catch yourself taking on a patient care assignment, stop. Believe me, I know how hard it can be. I've had to deal with it personally myself. But you can get yourself in trouble with both the School of Nursing and the State Board of Nursing. The college provides a universal course expectation form, and it's attached to this module. Make sure you include everything on the standard form and then add your specifics. The School of Nursing can give you examples of other instructors' expectations so that you can get a better idea of the information that others have put in their expectations. But at a minimum, you want to make sure that your contact information as well as the expectations per the policies and procedures for clinical rotations that are cited in the manuals for the School of Nursing are also included on your expectations. Clinical attendance is mandatory at Cochise College. Taking roll is actually a very good idea. You can create your own attendance sheet. You could use the one attached to the module, or you could get an attendance sheet from the college. Student role is taken in didactic nursing courses. Attached to this module is an example of a scavenger hunt. This is a great activity for the first clinical day. It helps students get familiar with the unit and have some fun. If you're not familiar with the unit, it can help you too. If your mentor also teaches on the same unit, then you may be able to get an updated and appropriate list of items from them. You can make the list as long or as short as you like, and you can individualize it to the things or the procedures that you think are the most important for anyone to know that works on this particular unit. I've attached a tool to assist students with performing a chart review. And this is just one example, and it may not be appropriate for your clinical unit. However, you might find the concept helpful for your particular student group. Knowing how to accurately document an assessment is a skill students need help with. Therefore, giving them a tool can help. Take a look at this example and see if you can modify it for your particular student group. As nurses, we know giving medications is an extremely important nursing duty. It can also be a very dangerous activity for students should they not be properly observed. Today, medication cards are often pre-made and medication information is often available on the computer right in front of the student. However, as a learning activity, most clinical instructors require some preparation before students give medication. They can create their own medication cards and keep a log. Examples are attached. The type of preparation can vary according to the nursing unit, specialty, and of course the level of the student. Each instructor can decide for themselves about their requirements for students. However, all instructors must take appropriate actions to ensure that students are administering medications safely. We know that medication errors happen all too often, even among us registered nurses. To aid in understanding students' thinking in clinical practice, here are a couple of tools that can be extremely helpful to you. Dr. Tanner developed a guide for students to use to put their reflections about clinical practice into words. She actually has a guided form which is attached to this module. So I'd like you to look that over and see how you might be able to implement that in your own clinical setting. I do need to caution you though, they did not ask the student to be this detailed after every clinical day. They assigned it as a learning activity. They said 4 times during a clinical rotation, 2 before the midterm and then 2 after, before the final. So depending on the length of clinical that you're teaching, you may or may not want to use this that many times, or that might be the perfect amount of times if you have like an 8-week rotation. They also did not implement this with the first year nursing student, but you have to understand they're teaching in a baccalaureate program. So look it over and then see how you might be able to maybe you can modify it to use it in your particular situation. And then what Dr. Lassiter did in 2007 is she came up with a rubric. I think the rubric is super because it really helps you as a beginning instructor and would help me if I were teaching today as well. Because the rubric gives you a good description of how the student is interpreting their clinical experiences, and it gives you an idea where they are. Are they still really confused in their thinking, or are they able to put things together in a logical way? Oftentimes I could do this when the students could talk about their experiences, and we can do that in the pre and post conference. But in writing, we can now think about how the student is thinking and then give them feedback and then answer the questions that they may have and then give them other guided questions so that they can think more deeply about their experience, or maybe help them to be less confused about what they were seeing. I oftentimes found that in clinical practice, that what I thought the student should be observing was not necessarily what the student saw. So by having them write about it, we can see if they're actually picking up on the clinical clues that we think they ought to be, or they may give us a total new insight that we really hadn't thought about. As I mentioned in the beginning, organization is extremely important for students. 2 additional tools are attached for both pre and post conferences to help students to narrow down the data so they can be more organized and to know what is the most important. Also, these tools can help students learn how to give an oral patient report. Take a look at these examples, and perhaps again you could use them as is, or you could modify them. Thanks for joining me on this module. I hope you find the tools helpful. They are attached to each one of the slides, and they're also attached to the attachment pane. So download them, use them, modify them. Good luck.